The risk of developing breast cancer rises steadily with age. In today's video, we are going to talk about the exact risk each woman faces in her life for developing breast cancer, as well as who should get mammograms before the age of 40, and what you can do to reduce your cancer risk. Welcome back to the FemHealth channel, a medical education channel by doctors for you. First, let's understand what absolute risk of breast cancer means. Absolute risk is the percentage chance that a woman will be diagnosed with breast cancer over a specific period of time. Let's start with women under 35. According to data from the American Cancer Society, women under age 35 have a very low risk. Their 5-year absolute risk is just 0.2%. This means that only 2 out of 1,000 women who are under the age of 35 will develop breast cancer in the next 5 years of their life. But as women age, these numbers rise. For women ages 35 to 39, the absolute risk increases from 0.2% to 0.3%. This is still very low, but it is rising. By ages 40 to 44, the risk doubles to 0.6%. This is why the general recommendations for routine mammogram screening start at age 40. This pattern of rising breast cancer risk continues as women get older. Women between the ages 45 to 49 have a 0.9% 5-year risk. In their early 50s, the risk grows to 1.1%. In the late 50s, it increases further to 1.3% of women getting breast cancer. Between the ages of 60 and 64, the risk rises to 1.6%. Women between 65 and 69 face a 2.0% absolute risk. The risk peaks between 75 and 79. The absolute risk for women 85 and older is the highest at 2.5%. The lifetime risk of any woman getting breast cancer is around 13% or 1 in 8. That means 13% of all women will have breast cancer at some point in their lives. Even though most national guidelines recommend regular mammograms starting at age 40 for women at average risk, there are some women who should be screened before 40. This includes those at higher risk, such as women who have a first-degree relative, like a mother, sister, or daughter with breast cancer. People who carry the BRCA1 or BRCA2 gene mutations should also be screened sooner, and any patient that has had radiation therapy to the chest should be screened earlier. For these women, earlier screening can help catch cancer at a more treatable stage. Getting a regular mammogram is important for reducing mortality from breast cancer. When breast cancer is caught early, it is likely to be treatable. Also, there are lifestyle factors that can increase a person's risk for developing breast cancer. Being overweight or obese, especially after menopause, can increase a woman's risk of developing breast cancer. This is because fat tissue produces estrogen, and higher levels of estrogen in the body have been linked to a greater chance of getting breast cancer. Drinking alcohol also raises the risk of getting breast cancer. Even small amounts of alcohol can impact risk, and the more you drink, the higher the risk of breast cancer becomes. Smoking is another factor. While the link between smoking and breast cancer isn't as strong as some other risk factors, studies have shown that smoking still increases the risk. Not getting enough physical activity can also raise your chances of developing breast cancer. On the other hand, staying active and exercising regularly can help lower that risk. Remember to chat with your doctor about when you should be screened and what you can do to lower your cancer risk.